Well, November is Lung Cancer Awareness Month, so we are talking with the Christ Hospital about the support and treatment options available for patients out there. We have nurse practitioner Ashley Campbell in studio breaking down what we're dealing with. And when you look at the numbers based upon the American Cancer Society saying like 225,000 U.S. adults will be diagnosed with lung cancer, that's a shockingly big number. Talk about when you hear those numbers, trying to get them down. It's prevention first and foremost, right?
Exactly, yeah. And thank you for having me today. So lung cancer is obviously still a very pertinent thing. It is still the leading cause of cancer deaths nationwide amongst men and women. And we can even combine prostate cancer and breast cancer together. Lung cancer still kind of takes the cake for that. So early detection and early intervention, early diagnosis is directly related to clinical outcomes. So if we can catch a cancer at an earlier stage, that can actually give patients curative treatment options.
Well, and you talk about that too, because I think not even 20 years ago, 30 years ago, you heard lung cancer and you probably thought that would be a death sentence.
Exactly.
Thankfully, that's not the case anymore.
Exactly. And I remind a lot of my patients that when we're talking about screening, a lot of times there's a little bit of a stigma around it, you know, like I smoked and now I'm at, you know, I kind of did this to myself. I remind them, hey, you know what, you know, just 10 years ago we could smoke in a restaurant, you know, so it's nothing to be, you know, ashamed of. Getting screened is the best way to catch it. And the way that we can do that was with low-dose CT scans, which only take about 10 seconds.
Yeah, and I saw this too and I wanted to ask you about it, but artificial intelligence is obviously the new rage out there, but it really is practical in a lot of different medical disciplines.
Exactly, yeah. We actually use AI a lot in our lung cancer detection software, essentially. It's integrated within our electronic medical record, and it kind of helps us eliminate that human error because there always is that component. And when we bring in AI, it really just boosts our confidence and our ability to catch these smaller nodules or spots in our lungs that could potentially be that early stage lung cancer.
And for the kids out there listening, vaping, I mean, we don't know what's in a lot of these vapes. And you know, you've seen a lot of people not smoke as much anymore, which is fantastic. But on the other side, I mean, there's still contributing factors.
Yeah. So obviously we know lung cancer can be caused by cigarette smoking, and that is 85 to 90% of lung cancers. There are a lot of other environmental factors. Radon's a big one, and then we also have vaping coming into the picture, where again, we don't know the long-term effects of it. We know that when we think about cigarettes, it can be thought more of harm reduction, so we're not getting those carcinogens, but the younger population, that's a big targeted audience where we're having a lot of younger people vaping where they've never smoked and they're never going to smoke, but now we're putting these younger people at risk for severe lung diseases and illnesses that could be completely life-altering.
Well, and too, so you're a nurse practitioner, you're kind of on the front line of this. Do people need to talk to their primary care physicians, nurse practitioners, if they think, you know, because there's cases with lung cancer that people have never smoked a cigarette in their entire life, and something just feels a little bit off.
Right. If you sense that you have any risk factors, like secondhand smoke exposure, again, another one is that radon. So it's one of those things that you don't really hear about until you're going to buy or sell a house, or if you're kind of in a setting where we see a spot on your lung and I'm asking you, hey, do you know if you have radon in your home? I encourage anybody that doesn't know, or if you live in an older home, get that tested. You can go to the CDC, you can buy a kit, and it'll tell you, because a lot of times that can equate to smoking a pack a day if the levels are high enough.
Well, and it's naturally occurring, so people are like, but it can be serious.
It can be very serious, and you know, so if you have any of those factors, secondhand smoke, family history, talk to your primary care provider. We can still do screenings and things like that that can kind of help mitigate. And if you've ever been told you've had a spot on your lung and never really followed up on it, follow up on it, you know. Get it watched, get it surveilled, and you know, it may not be anything, but it could be something.
Well, and last point too, before we leave, and something that it's important to note, we live in Kentucky, Ohio, and Indiana. There's a lot of contributing factors just simply being in this area too.
Yeah, so they just came out with the state of the lung cancer for Ohio. And nationwide, the average per 100,000 is about 55 people that will develop lung cancer. In Ohio, it's 88. So we know that just the chronic inflammation of our lungs here in the valley is a significant contributing factor to just lung injuries, which can lead to cancer.
It's such good information. You were so well spoken about it because it is important to get out there. Again, November, Lung Cancer Awareness Month. Just talk to your primary care physician, get checked. These guys will take care of you. It's nice to see you.
Yes, thank you.
Thank you. All of that information on our website at fox19.com. We're back on the other side of this break. Stay with us.